Guys, welcome to Subu Medicine, and this is anatomy. So guys, today we'll be discussing about the anatomy of the pelvis. That's what we'll be focusing on, okay? So, if you see the structure right here, okay, you guys know this, right? This is your pelvis, right? And this pelvis is made of, the 4 bones, about 4 or 5 bones, and also 4 joints, okay? That's what we'll be talking about. So, we have to talk about the different bony landmarks of the pelvis. That's what we'll be discussing here in this particular video, okay? So, like if you see right here structure, okay? So, first bone that I'm going to talk about here is that, okay, you see this structure right here? This structure right here? Okay, this part is going to be my sacrum, okay? And even if you hear in this picture right here, this, okay, right here, this part is your sacrum, okay? And about like 5 bones fused together to make this structure, which is a sacrum, like, So, all this part right here, this is my sacrum. So, you can see this part as my sacrum too right here, okay? And if you see below down here around this area, okay, like around this area right here, this area, okay, there's going to be a joint, okay, that is connecting this sacrum and this bone, okay? And this bone is what? It's called coccyx, okay? Or you can call this as a tailbone also, okay? So this together are connected by, there's a joint, okay? The name of the joint is what? Because it's connecting your sacrum and your coccyx. So we can simply call this as a sacrococcygeal joint, okay? That's what it is here. Now, these are 2 different bones, okay? These are 2 different bones, okay? That is making this pelvis, all right? But remember, there's also other 3 bones, which are also called coxal bone, okay? That's what we have to talk about, okay? So, if you see this portion right here, all the way down here right here, okay? This part right here, we call these structures, okay? This is an ilium, and this is one of the largest coxal bone here, okay? All the way down up to here. Then after that, you see this bone right here, okay? In here, this is going to be my, okay, pubic bone right here. This is my pubic bone right here, okay? So, then after that, okay, there's another bone we have to look at in a posterior view, okay? Because this is going to be my posterior view right here, okay? So, if you see the structure right here, okay, this is going to be my sacrum, and this is my coccyx. This is my ilium right here, okay? And this portion, okay, this portion right here, okay, this portion is called your ischium, okay? So, your ilium, ischium, okay, this ischium, and the anteriorly view, you see this, okay, if we turn around the structures right here, you see this structure right here, okay? This is a pubic, okay? This all together, your sacrum, coccyx, your ilium, your pubic, and your ischium bone, okay? They make together they form this structure, which is called your pelvis, okay? Now, after that, we have to talk about a little bit about, we have to go a little more depth about this different landmarks, okay? So if I see this, if I said this, you're looking at this right now, the anterior view of this, okay? So this structure right here, okay, this whole is ilium, right? All the way down up to here. You see this depression right here, okay? That is called your iliac fossa, all right? The iliac fossa. And if you see right here on this structure right here, okay, this is going to be iliac crust. All right, and even the iliac crest had like a further divisions. Like this part, you can call them an inner lip, and there's a middle portion here called the intermediate zone. Okay, you can call that iliac crest. And then, if you come back here, okay, this structure right here, okay, this one right here, this is called anterior. Okay, I'm going to put in my finger here. This is called anterior superior iliac spine. Okay, if there's a superior iliac spine, there has to be posterior iliac spine too, and we'll talk about that. But before that, okay, this is anterior because it's still ilium, and this portion right here, okay, this is called anterior inferior iliac spine, okay? That's right, because we're talking about the iliac. And this line right here, okay, you see this one? There's going to be a line that you get to see here, like this portion right here, okay? We call this as, okay, this is a arcuate line of your ilium, okay? Because this whole structure is your ilium, right? Now, these are the different bony landmarks of your ilium. But if I also turn around this structure, and if you look at the posterior aspect of the ilium right here, okay, if we look at this, posterior aspect of the structure, if you see this right here, okay, this portion right here, we call this a posterior superior iliac spine, and then down here, this is called posterior inferior iliac spine, okay? Now, that's what it is. Now, let's just talk about this. Now, if you hear, if you see this is going to be my what? This is going to be my pubic bone, right? Pubic bone. In this pubic bone, okay, this portion right here, okay, this here, the elevation you get to see, this is called your, okay, this is your pubic tubercle, okay, that's what it is called. And also there's a line here, if you see this, there's a line coming down here, okay, there's a line coming out here, this is going to be called as your pectinate line, okay, and there's importance of pectinate line and also the pubic tubercle because there's a different tendons and ligaments that get attached there, okay. Now, remember, there's whole this portion right here, okay. There's also this all the way up to down here is going to be a pubic, but this portion is going to be ischial, okay. So, pubic and ischium is connected by your pubic ischium ramus, all right. That's what it is. Now, but remember, what is the structure right here? You guys see here, right here, is bringing this and connecting this guys together, okay. This is what your pubic bone right here, okay. And then this also, what is this connecting structure? This is a cartilage. This is a cartilage, okay. But this is a fibrous cartilage. It's a secondary cartilage. It's a fibrous cartilage, okay, which is called pubic symphysis. That is actually this is a joint, okay, that is connecting these two bones. Okay. Now, so we talked about like the 5 bones, right? That is making a pelvis. Sacrum. Let's repeat this. Sacrum, coccyx, ilium. This is going to be pubic bone, and this portion right here is going to be your ischium. Okay. Those are the bones that are making the pelvis. Okay. But remember, we also have to talk about the joints that is contributing to this bony landmarks. Okay. I mean to the pelvis. So if we have to talk about the joint, we just talked about one joint, which this is called your pubic symphysis, right? Symphysis. But there's other joint, okay, here, right here. This joint, which is connecting the sacrum and what is this? Ilium, okay. This joint, it's called, okay, there's a joint here, which is called, because it's connected to sacrum and ilium, we can call them a sacroiliac joint. Okay, that's what it is called. And there's one here and there's 2 here. There's a 2 sacroiliac joint here, okay. Even if you look at the picture right here, okay, look, right here. See if you see this. This is okay, there's a joint here because you look in the anterior view here, right? This is going to be you look, this joint right here, okay, there's a joint here. There's going to be a sacroiliac joint here, okay, that's what it is. And then this portion right here, all right? This joint right here, okay, sacroiliac joint, right? And there are 2 of them. That's 1, 2, okay? And we just talked about this pubic symphysis. And there's also one more joint which is connecting, look, this coccyx or the sacrum, okay? And that's a pubo because it's a sacrococcygeal joint, okay? That is contributing or forming the pelvic, all right? Now we also talk about, like, if you look at the structure right here, okay, this part, okay, if we just quickly talk about little bony marks of your sacrum, look, this part right here, this is called, all right, this area right here, okay, these portions, we call them your sacral promontory, okay, that's what it's going to call. If you look at here, okay, let's look at here, this portion is called your sacral promontory, okay, even if you hear, this is a diagram of this sacral promontory, and if you see, this is what, this is a vertebral column, right, look, this is your L5, okay, and that is sitting at the base of your base of the sacrum, okay, because hold this portion right here, okay, we call them a base of sacrum, all right. Now what else do we have to discuss about? Let's talk a little more bony marks of this, okay. So this, guys, there's a pectinate line here, this is a pubic tubercle, but this portion right here, we call them a pubic crest, okay, this is going to be a pubic crest here. And now let's talk about later, if we turn around this, okay, let's talk about, if we look at the posterior view of this, okay, so this is ischium, right? Look, guys, this part, this elevation coming out, okay, this elevation of the posterior view you get to see, this is called issue of the spine, okay, is important there. okay? Because the ligaments are connected here, okay? And then you see this one right here? This is called your ischial tuberosity, okay? Because certain ligaments and tendons get attached here, okay? Ischial spine there. And you see this big hole right here, okay? This is called obturator foramen, okay? There are two of them, all right? Now, and this right here, okay, this is in your sacrum, like all this part. And then this right here, you see this? More like a triangular shape. This is called sacral hiatus, all right? Now after this, okay, we have to go and talk about a little bit of the ligaments here, okay? Remember, what is ligaments? Ligaments basically means is that whenever, ligaments connects bone to bone, okay, and that's going to form a joint, right? So here, which is connecting the sacroiliac joint, okay, you're going to find the anterior, okay, the sacroiliac joint ligaments, right? And then also posterior too, because if you're talking the back, you're going to get to see that too, okay? And then also one more thing that we were talking about is that, let's turn around the posterior and we'll see in a better way actually. There's a ligament that is attaching from here, okay, that's coming from here, or from this one, okay? That ligament comes down here, okay? And what it does is that, okay, you can imagine this as your ligament right here, okay? Let's talk about this. Here, comes down here, okay, and then joins. It passes to the coccyx, okay, and goes and connects with this tuberosity, okay. So if connects with this tuberosity, okay, we call them a sacrotuberous ligament. That's what we call them, okay, like this, sacrotuberous ligament. All right, that's what it's called. And then there's also one more ligament, okay, which is coming from the lateral of the sacrum, okay, and then that is going to go and attach to this ischial spine, okay. Because it's a sacrum, it's attaching to the spine, we call them a sacrospinous ligament, okay? So when the sacrospinous ligament forms like this, okay, look at this. And there's also one more structure right here, okay? So let's make this as one here, and also one more going and connecting with your tuberosity, okay? So because it is attaching with it's actually going to attach with your pubic tuberosity, okay? So because it attaches to the pubic tuberosity down there, okay, we call them an ischial tuberosity, or ischial-tuberous ligament, okay? That's what it is. So whenever it connects like this, okay, you see there's a space, you see a gap right here? Okay, this is called your greater sciatic foramen here, and there is space right here, okay, there's down here, okay, this, we call them a lesser sciatic foramen, okay? Now, if we turn around this, okay, actually, let's not turn around this. If you look at this down here, okay, this is obturator foramen, right? There's also one ligament is coming down here, okay? I keep falling this down. This part right here, okay, there is gonna sort of like, on top is covered in this obturator foramen. That is called obturator membrane, okay? And when it's coming, there's a small gap you get to see, okay? That is called obturator canal, all right? Now, after these bony landmarks, okay, let me actually show you guys in a diagram right here, okay? Because if you look at this picture, so like, look at this down here. So, all this part right here, this is going to be a promontory right here, okay? And look, I talked about this anterior inferior iliac spine, superior iliac spine, all that kind of stuff, right? Now, I also said an arcuate line of this, okay? And I also saw the coccyx. And then look, this is a portion right here. I talked about in posterior ischial spine, right? This here is coming out from here. If you see my hand right here, okay? And this is also pubic symphysis here, okay? And I also talked about the pubic tubercle, which is this one, right? And I talked about the arcuate line also, okay? Now, let's look at the different pictures, okay? I also talked about all these different types of structures right here, okay? The sacrums and all that kind of stuff, okay? And I also discussed about the, diagram. If you look at this, I also talked about which one is ischial tuberosity, and this hole is obturator foramen, and also the ischial spine, which I talked about that, okay? Now, let's go further, okay? And this is in a radiograph image, this is what you get to see, okay? So basically, look, again, I'm repeating, this is going to be an ilium right here. Okay, this is sacroiliac joint because it's connecting sacrum and the ilium, so we call them a sacroiliac joint, right? So and there are different ligaments there. Okay, there are interferous ligament or anterior superior iliac ligament, okay? That's all this called. And this is your sacrum, as we discussed. This is your pubic symphysis right here. And we also talk about the ramus of the ischium, because we call them ischial. It's a pubic ischium ramus, which is actually connecting your pubic bone and your ischium, okay? And then we talked about the arterial foramen, okay? But this is, if you look at this is a male, okay? This is a male. And if you look at this male, it looks more like a, heart-shaped sort of a structure right here, this one. This structure, okay, it looks like this way, we call them a pelvic inlet. We'll talk about that too. And this is more like an anterior posterior view. And this is a female picture, okay? And the radiograph image, let's talk about. And this more looks like an oval shaped, okay? It doesn't look like a heart shape. It's more looks like an oval shape, all right? Now, and this is what I was talking about, the different types of ligaments that we discussed about it, okay? Look, you see this is, guys, okay? Now, if you see here, look, this ligament I talked about, this is like a sacrospinous ligament because this is your sacrum right here, okay? And that's connecting to the ischial spine, okay? So that's why we call them a sacrospinous ligament. And that is making what? Your greater sciatic foramen and lesser sciatic foramen right here, okay? And further, look, this guy, this is called your sacrotuberous ligament, right? The reason why we call them a sacrotuberous ligament is because it's connecting from the sacrum to your pubic tubercle. And I'm sorry if I made a mistake saying that it is connecting the pubic tuberosity. It's actually not. This sacrotuberous ligament is actually coming from the sacrum, passes to the coccyx, and then it is attaching to this pubic tubercle. That's why we call them a sacrotuberous ligament. So when you see this, look, it further divides, or you can easily get to see this space right here, okay? That space we call them, okay? Look, when you do this, okay, you get to see the space right here, okay? This is called lesser sciatic foramen and then greater sciatic foramen, okay? Now that's what it is. And we talk about this pubic symphysis, and this is a secondary cartilaginous joint, all right? And we also discuss about all this other structure too, right? Now, this is like a further, okay, ligaments that you get to say. And even here, okay, whenever this connecting from your, let's say, your ilium to this lumbar part here, we call them iliolumbar ligament, and this whole ligament is here, basically the sacrospinous ligament, okay? And we have been talking about this too, all right? Now, so guys, this, now if you come back here, like this portion right here, okay, all this, okay, from here, look, this area right here, we call them ella, and ella means wings, okay? This is called margin of ella, okay, and this is a ligament attaching, and this is called what? The arcuate line, okay? And then if you come back here, you're going to see this pectinate line, and then you also see the pubic crest, okay? All this portion right here, okay, we call this a pelvic brim, or we can also call it a pelvic inlet, okay? If you look at this, is very important because this is called your pelvic inlet, okay? Now, if I make this right here, if I turn around this, okay? If you look at this down here, okay? Now we're looking at the posterior view, okay? Look, what is this? Sacrum, right? Here, right? And then, what is this? The sacrotuberous ligament right here. And then, look, this is going to be your ischial spine. This is going to be your ischiopuberamus right here. And that is down here is going to be pubic symphysis, right? This part right here, from all the way down here, this is called your pelvic outlet, okay? This portion is called your pelvic outlet, all right? And there's importance of this, okay? Anything above this pelvic brim right here, okay, we call them, okay, anything above this pelvic brim or pelvic inlet, okay, we call them, okay, it's a false pelvis, all right? And anything below that, we call them, okay, lesser pelvis or true pelvis, okay? That's what it is. Now we have to talk about, there is going to be difference between the pelvic inlet, okay, when it comes to male and female, okay? So the way we determine whether it's a male and female pelvis is there's something called subpubic angle, okay? And where's that located? The location of that is, look, if you see here, okay, this is going to be what? That's going to be right here, this portion right here. That is going to be your, okay, this is going to be your ischial-pubic ramus, right? Between the ischial-pubic ramus and inferior to this pubic symphysis, okay, there is this angle called subpubic angle, okay? And the way they determine whether it's male and female pelvis is, through something called birth canal, examinations. Whether it's a vaginal exam, so they call the pelvic exams, okay? What they do is you put obviously wearing gloves, right? So, they put like a 3-finger inside the birth canal, okay? So just like this right here, okay? And the width of the subpubic angle, okay? Usually in male, it's less than 90 degrees. In female, the width of that subpubic angle is greater than 90 degrees, okay? And that can able to tell us whether there's a male and female pelvis. And that also tells us about something called, okay, whether the baby can able to come out or not, whether the baby is going to have a natural birth or whether we have to do a C-section, okay? So clinically it's important to know the subpubic angle, all right? Now, other thing that we also have to talk about is that whenever females are pregnant, right, there's something called an exam of pelvic, okay? There's a Pelvimetry, that's what they call it, right? So what they do is like, they actually look at the distance from the sacrum, okay? Sorry, look at this. Distance from the sacrum, okay, to the pubic symphysis, okay? When they do, like the true conjugate, okay, which is the anatomical way of doing it, okay, this is not a correct, this is anatomically correct, but usually they don't use this to understand whether the baby head will come out from the birth canal or not, okay? So what they do is that they use something called this obstetrical conjugate or diagonal conjugate. So this obstetrical conjugate is looking at this sacral promontory, which is posteriorly located, and measuring that to the pubic symphysis, okay? And usually the distance is about like 12 centimeters. And also, the clinically what is more important is this diagonal conjugate, okay? Because this diagonal conjugate is basically, 2 centimeters greater than this obstetrical conjugate. If this is like 12 centimeters, okay, which is that, this obstetrical conjugate is usually about like a 10 centimeters long, okay? So this diagonal conjugate is basically, okay, becomes like, if you're able to measure and the distance of that diagonally is this, if it's like 12 centimeters or so, we can able to say that, okay, this pelvis, okay, it is sufficient for, okay, the sufficient pelvis to give, okay, birth to your birth canal, okay? So there's probably further now needs to do a C-sections, okay? So it is a clinically way of knowing that whether or not the baby can come out from this, okay, because look, the baby will move kind of like navigate like this and come to the pelvic inlet, okay? So this is something that you should understand. And remember, the different types of this pelvis, okay? Usually male, as we discussed before, male is more like heart-shaped, okay? This one. And they are like, is a thicker and heavier, okay? But female, it's a lighter and thinner, okay? And the cavity is going to be wider and bigger. Male is going to be smaller cavity, okay? And this is more like oval type of shape. This is a heart type of shape, okay? And for this heart type of shape, they call this a special name given for that, which is called android. And the female, we call them gynecoid. And these are other different types of those, the female pelvic, they're like platyploid or anthropoid. And if you can look at this and if you compare and contrast, you see a difference of this, okay? Different types of this pelvic inlet, all right? And also the pelvic cavity, or different types of pelvis you get to see in female, okay? Usually this is what you see in male, all right? So guys, this is all I have for you guys. I hope that I made it very clear to you guys. Please don't forget to subscribe, like, and share the channel, all right? Thank you.